Good evening, Sarah here from First Aid for Families. Hope you are all well this evening. I'm here with my friend Bob here to demonstrate, and what we're going to be talking about today is the AED, or the Automated External Defibrillator. So I'm going to wait a couple of minutes to see if anyone jumps on to the live. I think Emma's here as well, and then we can get started. Okay, so why did I call this Bob? Bird or bloke? Can't decide, so we call him Bob. And I'm going to bring out Bob Jr. later on as well, so we'll demonstrate the use of an AED on a child as well. So we'll just wait a couple more seconds and then we can get started. We've got a fly buzzing around here now, so that's going to be nice and distracting. Okay, now with questions, I'm quite far away from my screen, so I can't really see the questions that are coming up. So what I'll do is I'll run through the demonstration of the use of the AED and go through the explanations of it all, and then at the end I'll take any questions that you have on this or anything else for tonight, and we'll play it that way. I might be doing a bit of moving around so that I can get closer to the camera, and I hope you guys can hear me all right, so just give me a thumbs up if you can, and we'll get started. Okay, right, AED, Automated External Defibrillator. Now the reason a defibrillator is so important is that it actually makes a difference in saving lives. You'll see defibrillators come in different packaging, disguises and things like that. You might see them outside of pubs, outside of village halls, in old telephone boxes, all over the places, and communities are getting together to sort of like buy pieces of equipment like this because they really do make a difference when it comes to saving lives. Now, what does it do? Now, the problem comes is when either someone has a heart attack or there's a lack of oxygen supply to the blood. And the heart can do several things. It can go into cardiac arrest, which means the heart will stop, or it goes into ventricular fibrillation, which we call VF. Now VF is when there's electrical impulses going through the heart. So imagine that's your heart. Normally your heart pushes electrical impulses from the top to the bottom. It goes do 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 like that. I'm not going to carry on doing that. So you've got the electrical impulses passing through the heart there. Now, if there's a problem with the electrical responses there, then the heart doesn't know what it's doing. It's almost like a misfiring. It's all over the place. And what will happen there is that casualty will stop breathing. Now, when we come to dealing with a casualty, we don't know what state the heart is in. There's no way of actually telling whether that heart has stopped or it's in that VF, that ventricular fibrillation. So that is why it's so important to have an AED. Now, with a heart attack, so if someone stops breathing after a heart attack, it's very common that their heart is in VF, right? And if the heart is in VF, this is where this machine comes into play, okay? If there's no output and that heart is in cardiac arrest, this won't work. And what we need to do then is just carry out CPR. Now you'll see actually on the boxes, so where these are actually stored in the community, you'll see a key code for these. Now if you ring the emergency services, obviously tell them you've got a casualty, they will be able to point you in the direction of the nearest AED and will give you that key code to actually unlock it. Anybody can use these, okay, so please don't be worried about these things. It's going to tell you exactly what to do, all right? So anyone can actually use this bit of kit. All right, so you've got your casualty and you've got your defibrillator, all right? Now the inventor of this said the only way you could do any harm with it is if you actually picked it up and banged it on the casualty's head, which we're not going to do, okay? So be confident with this, it's going to tell you what to do. Okay, now the first thing that you need to do is obviously to take it out of the box, open up this lid, and what you'll have inside or next to them are some pads. All right, these have been used quite often before. This is a training defib, so there's no voltage through this, so don't worry, I'm not going to do anything crazy tonight. All right, I use this for training. And what you can see on the screen here and on the defibs that you'll find in your communities, they'll be very similar to this. So you've got the pictograms there and a very simple display of what we're going to do. All you need to do is to turn it on. Okay, I'm not going to do that just yet because it's going to start talking to me. Right, so I will turn it on, it'll go through a calibration and it's going to tell you exactly what to do. And it's going to tell you to open the airway for the casualty. It's going to ask you to check for breathing, okay? And then it's going to ask you to carry out CPR. And we're going to talk about and cover CPR at some point, but I wanted to talk about the defib first. But with CPR for an adult, it's 30 chest compressions to rescue breath. All right, and I think we talked about this a few times in our lives over the past couple of weeks. And you'll continue to do that. Now, with the defib, what we need to do is to get these pads onto the casualty. These are super sticky, all right? Now, with the ones in the community, they're going to have adult pads and children pads. And again, we'll talk about the differences there. And if I forget to, then please prompt me in the comments, all right? So we're just going to put this down here a second. These sets of pads are like that, okay? So you can see we've got the casualty here, we've got the cross, and we've got two pads, and they're all stuck together, all right? That cross is going to go in the centre of the chest, so basically between the nipples, okay? Super sticky. We're going to take these off, all right, and we're going to put them on the casualty. Now, there might be a bit of housekeeping to do before we do this, all right? Imagine this is quite a hairy gentleman. What you'll find with the defib is a razor and some scissors. The scissors are to cut clothing off because these pads need to go onto a bare chest, all right? And the razor, yes, you're going to be doing some shaving. Now, shaving the chest, what you're going to do is just shave the area you're going to put the pads in. Don't spend hours doing a bit of artwork, all right? Just where you're going to put the pads, because what we want is contact onto the skin. All right, and again, these are super sticky. So you peel off the back, like that. That one goes here, and I'll show you where they're going in a second when I move the defib. And that one goes there. Right, okay. That's a bit wonky. So they go on like that. Okay, so as you can see on Bob here, we've got one pad just below the collarbone, all right, and the other one is a cross over down the waist here. Because what this is going to do is when we press the button to give that person that electric shock, it's going to pass voltage, electricity, through the heart. So it's making a nice pathway across to the heart there, all right? So it's really important to get good contact on the skin here, all right, so we can get that nice pathway. For children, and when we're talking about children, we're talking about over the age of 1. We shouldn't be using them on babies, and I'll talk about that in a minute. Again, if I forget, please prompt me. For children, if they're a small child, so child is from the age of 1 up to puberty, which actually can be quite scary because people are saying that's around 8 years old now, okay? But it will depend on the child. So on the child with a defib, if they are quite small, put one pad on the front and then one pad goes on the back. If the AED that you're using hasn't got children's pads, it might have a button actually on the AED to change it between adult and child, okay? So all it is just a reduced voltage going through there, okay? If it doesn't, still use it on a child, but try and get it in the correct position. Remember, what we're trying to do is get that path across the heart with the electricity there, okay? Bear with me. All right, so now we've got the pad set up. Things to think about: jewellery, underwire bras, okay? We don't want the electricity going through the bra. We want a nice direct contact through the body there, all right? So just make sure that we cut off clothing, all right? Make sure any materials out the way. Pacemakers as well. If someone has a pacemaker, it's generally quite clear. It will be over on the left hand side here and it'll be slightly raised. You can still use an AED with someone with a pacemaker, all right? But just don't put the pads on the pacemaker. All right, and so we've got the pads nicely in place there. All right, now then, have we got any questions so far? I can just about see there. I don't want to sort of like give loads and loads of information and lose anyone. So if this is an okay pace, then just give me a thumbs up and I'll keep going. No? Okay, right. So we're all set up. Now, while we are setting up on the AED or the defibrillator, someone should be carrying out CPR. We don't want to interrupt CPR as we're putting them on. You just stop just enough to get the pads on. All right, so someone's shaving, someone's doing CPR. Okay, so again, it's a bit of a team effort. If you're on your own, you just got to do your best. Okay, right. So the defib is on the casualty, and what you're going to do is to make sure that it goes through its check. Now remember, it's an automated system, the defibrillator, so it's going to check. So it will recognise that the pads are on and it's going to start checking and it's going to tell you. Now when it's going through its check, you do not want to be in contact with the casualty because it could pick up you instead of the casualty. So we need to make sure everyone is standing back and hands clear of the casualty here. All right. It's then going to check to see the state of the heart. Remember, if I said the heart has no electrical impulse or electrical movement through there in cardiac arrest, the machine's not going to do anything. So you're just going to carry out CPR until the emergency services arrive. If it's in VF, so if the heart's in VF, so it's sort of like trembling, it's misfiring, it's not doing what it's supposed to be doing, it's going to say that you need to shock the casualty. The shock is going to stop the heart. So the defib is not a heart restarter, it's a heart stopper. They're not going to put that on the display board. It might scare people from not actually doing it, okay? But it's going to stop the heart because what we want to do is to take it out of that irregular rhythm, stop the heart, and then your brain hopefully will go, okay, that's not right, and restart in its normal rhythm. Okay, so this is what the defib is trying to do, okay? Now, let me demonstrate with this on for you. Okay, very simple with machine. It's going to be, I think it's quite loud, so bear with me. I'll turn it on and I'll run it through the system, all right. So it's flashing up.
Unit OK. Stay calm. Check responsiveness. Call for help. Open airway.
So it's prompting you.
Check breathing.
Okay, and when we check breathing, we're going to go down to the casualty's mouth and we're going to check for 10 seconds. So this will give you the
Attach
time.
defib pads to patient's bare chest.
Okay, we're putting the pads on the chest. Okay.
Attach defib pad, don't touch patient. Analyze it.
Okay, so now we need to make sure no one is touching the casualty and we're just going to stand back there.
Don't touch patient. Analyze it. Shock advised. Don't touch patient. Press flashing shock button.
Okay, so it's recognised the heart is in VF. Standing back from the casualty.
Don't touch patient. Shock delivered.
You press the button.
CPR.
Then you go back into CPR, all right? And you'll carry on doing CPR for another 2 minutes. This will then check again. It'll go through the whole checking, making sure...
Continue CPR.
Checking it all again, and then it will either say you will need to shock them again or just carry on CPR, all right? And you keep going. I know in the movies you kind of hear, oh, this is their third shot,
Continue
you know.
CPR.
This is the last one.
Unit OK.
It's not always that case. If this tells you to shock the casualty, you shock the casualty. Now, if the heart stops and starts beating regularly, correctly, then it will not allow you to shock the casualty again. All right, so you can't make a mistake. It will stop it, it will shut it off so that you can't press it again. All right, so again, just be aware of that. Really simple bits of kit. All right, so spread the word. You know, anybody can use them because it's going to talk you through the whole process. Okay, generally they're in English, so if you're abroad, they normally actually are in English language as well. So again, just utilise them as you can. Now, the emergency services, when they turn up, obviously they're going to assist you and they're going to help you out with this. What they will probably do is just connect your defib or your pads and plug it into theirs. All right. If your casualty starts coming around, keep this all on them. This is a great monitor because it will actually monitor the heart rate as well. So keep it all on them, and then if they relapse, then it's all set up ready to go again. All right, so again, you don't have to do anything, you just need to put it on, start it, and listen to the instructions there. Okay. Right, have you got any questions? Can you do CPR with the pads on? Yeah, absolutely. So just keep the pads on. On this one, you've got the cross there, which will show you exactly the placement of your hands as well. So that's really helpful. You won't need to take any of this off. Just keep it all on, keep it all functioning, and it'll be fine. Now, the quicker we can get this to the casualty, the better, and the chance of survival goes up quite high, from about 21% to about 70%. So you can see statistically these are lifesavers, okay, and people are using them all over the place. So what sort of place should have this kit? Anywhere. I mean, we're seeing them all over the place now. I think because they were so expensive, it was almost impossible for communities to have them, and schools and things like that to have them without fundraising, but anywhere. I did a lot of training with guys on the railway, and with electricity, so if electricity passes through you, the likelihood the heart is going to be affected, so they really need them, so they're actually carrying kits out with them to work as well, which is really good. Yeah, so anywhere really. There's good apps that show you exactly where the AEDs are in the community as well. Yeah, and they're for public use, so if there's a sports centre that you know that has one, they'll probably let you borrow it. You know, I can't see anyone saying no to not actually using their defibs. Something will probably go wrong if they say no to that. Have you got any other questions? I can see one. Leaving the casualty. Sorry, I'm just going to reach over here. Laura, would you leave the casualty to get the defib? Depends how far away the defib is, to be honest with you, Laura. You can call that at the end of the day. What's really important now is CPR. It's getting that oxygenated blood around the body, in particular to the brain, with CPR. If you can, then please do. Priority is definitely ringing 999, because if there's somebody that's not breathing, hopefully they're going to be with you within 3 minutes. And when we talk about chain of survival, early access to that casualty, early CPR, early defib, and if we're talking within a 3-minute period of time, then the chance of survival increases. So it's really quick. So 5 minutes away, send someone to stay with the casualty. Yeah, if it's 5 minutes away, then no, definitely I'd carry out CPR. Remember, the emergency services, they'll carry them, the ambulance crew will carry defibs, so they'll have one on the unit and they can start using it. But make sure you carry out CPR before they arrive. Okay, any other questions? Has anyone got defibs in their community or in their workplaces? And if so, have they been trained on them? I think that's the key, isn't it? A lot of people don't get trained on them, and people are scared about using them, especially, we're saying that we're going to put electricity through somebody, you know, we don't want to really do that, do we? All right, so again, we want to sort of like encourage people to use them, and if not, get the community wardens and people like that to do some training, get some training put on for the community, and workplace training as well. That's really important. Anybody, it's safe to use a defib on anybody, okay? Because all you're going to do is set it up, and it will only allow you to shock the casualty if their heart is doing the VF, okay? The likelihood that a child will need a shock is low, because within children it's normally a respiratory issue than circulatory or a heart issue, and that's the same for infants as well, so under the age of 1, so it's very unlikely that an infant will need it. Pregnant women, okay, again, yes, you can use a defib on a pregnant woman. There's a few things that might need to be readjusted, especially a heavily pregnant woman, that you might have to sort of like move their boobs around a little bit to get the placement of the pads correct. All right, people do worry that actually it's going to harm the baby, but if we don't deal with the mum, they're low as well. Oh, I don't know what's happening. Am I still there? Yeah, I'm still there. Okay, thought my Wi-Fi was going a bit crazy. All right, so yeah, I don't think I've got anything else to say on the defib, but if you have questions, just shout, just put them in the comments below and I can come back, and if you want any more information on them, then absolutely brilliant. I'm just going to have a quick look. I'm so far away from here. No. Well, it was really nice talking to you guys this evening, and as I said, if you've got any questions, then have a look. Oh, why do you put a child's pad on the back? Why? On a small body, as you can see, the pads are quite large. The children's pads are smaller, so they're going to be you're more likely to be able to get them into that position. But for adult pads on a child, then it's going to be middle of the back, middle of the chest. Okay. All right. Yeah, so front and back, Laura. Brilliant. Right, take care, and I will see you next week. Same time, different subject. Take care. Bye.